Good day everyone, I'm Divine Divina Gracia, your student nurse from BSN 1A, and today I am going to perform the head, neck, and lymph nodes assessment. But before I start, I am going to prepare the equipments needed. So I have here a stethoscope and a glass of water. Prepare the client for the head and neck examination by instructing him or her to remove any wig, hat, hair ornaments, pins, rubber bands, jewelry, and head or neck scarves. Introduce yourself and verify the client's identity. Explain to the client what you are going to do, why is it necessary, and how the clients can cooperate. Good morning, ma'am. I'm Divina Gracia, your nurse student for today. Can I ask your name, ma'am? I'm Aliyah po. How old are you, ma'am? 19. Okay, so today I'm going to assess your head, your neck, and your lymph nodes. Observe appropriate infection control procedures and provide for clients' privacy. Inquire if the client has any history of the following. Can I ask if you have any history of lump, itching, scaling, or dandruff? How about loss of consciousness, dizziness, seizures, headache, facial pain, or injury? Wala. Inspect the head for the size, shape, and symmetry. Head is symmetric, round, erect, and in midline and appropriately related to the body size. No lesions are visible. Inspect for involuntary movement. The head is held still and upright. Palpate the head. Wear gloves to protect yourself from possible drainage. The head is normally hard and smooth without lesions. Inspect the face. Inspect for symmetry, features, movement, expressions, and skin conditions. The face is symmetric with an elongated appearance. No abnormal movements noted. Palpate the temporal artery, which is located between the top of the ear and the eye. The temporal artery is elastic and not tender. Palpate the temporomandibular joint or the TMJ and ask the client to open the mouth. Normally, there's no swelling, tenderness, or crepitation with movement. Mouth opens and closes 3 to 6 centimeters between upper and lower teeth. Lower jaws move laterally 1 to 2 centimeters each direction. Inspect the neck. Observe the client's slightly extended neck for position, symmetry, and lumps or masses. Neck is symmetric with head centered and without bulging masses. Inspect movement of the neck structures. Ask the client to swallow a small sip of water and observe the movement of the thyroid cartilage and thyroid gland. The thyroid cartilage and cricoid cartilage move upward symmetrically as the client swallows. Inspect range of motion. Ask the client to turn the head to the right and to the left shoulder. Touch each ear to the shoulder, touch chin to chest, and lift the chin to the ceiling. The neck movement is smooth and controlled with 45 degrees flexion, 55 degrees extension, 40-degree lateral, and 70-degree rotation. Palpate the trachea. The trachea is in midline and symmetrical. Palpate the thyroid. The position of thyroid is in the midline and the characteristics are firm, non-tender, and smooth. Auscultate the thyroid. No brutes are auscultated. Palpate the lymph nodes. Palpate the preauricular nodes in front of the ear. Postauricular nodes behind the ears. And occipital nodes at the posterior base of the skull. Palpate the submental nodes, which are few centimeters behind the tip of the mandible. And palpate the submandibular nodes located on the medial border of the mandible. Palpate the tonsillar nodes at the angle of the mandible on the anterior edge of the stereomastoid muscle. Palpate the superficial cervical nodes in the area superficial to the sternomastoid muscle. Palpate the posterior cervical nodes. Palpate the deep cervical chain nodes, deeply within and around the stereomastoid muscle. And then palpate the supraclavicular nodes by hooking your fingers over the clavicles and feeling deeply between the clavicles and the stereomastoid muscle. There's no swelling or enlargement and no tenderness. Document findings in the client's record. Thank you for your cooperation, ma'am. And after the procedure, don't forget to perform the hand hygiene.